and सिर्फ ये जो आपके and सिर्फ ये जो आपके 24 and 25. But before I speak, I would like to raise my voice on behalf of AITC that the GST should be removed from life insurance and medical insurance as early as possible. And if the finance minister is unable to do so, then we have to protest in very large scale. So, first of all, what is health? If we go by the definition of WHO, it is a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. That means to have an effective healthcare system, we have to think not only treating the physical illness, but also to address the mental illness and prevention of the disease. Health is wealth. This is timeless truth, and it has been known since our childhood. As we aspire the Viksit Bharat by 2047, we can achieve this without taking health into account. So although the allocation for the health and family welfare has risen from 80,000 crore to 90,000 crore, the current funding is still too low to meet the country's health need. The National Health Policy of India 2017 aims to raise public health spending at least 2.5% of GDP by 2025 to improve the healthcare system. However, the current budget allocates only 2.1%. This is inadequate for strengthening primary health care and improving the national health program. There is imperative need for dedicated funding for mental health services, including the indoor and rehabilitation facilities, counseling, community-based program, as well as investment in the public awareness campaign to reduce the stigma associated with the mental disorder and to promote mental health. Throughout the India, several central government health projects are encountering significant difficulties. The allocation for Pradhan Mantri Ayushman Bharat Health Infrastructure Mission has decreased from 4,200 crore to 3,200 crore. That is 1,100 crores has been decreased. In this context, on behalf of people of West Bengal, including those in my constituency, I would like to express my heartfelt thanks to Srimati Mamata Bandyopadhyay, our Chief Minister, for introducing the benevolent Swasthya Sathi scheme back in 2016, much before than the Pradhan Mantri introduced the scheme, that is the Ayushman Bharat in 2018. The Swasthya Sathi scheme provides benefits up to 5 lakh per family per year to the all residents of West Bengal, regardless of caste and socio-economic status. Coming to the Pradhan Mantri Swasthya Suraksha Yojana, there is gross dip in the allocation from 3,365 crore to 2,200 crore. The primary aim of the project is establishing and upgrading new AIIMS and district hospital. But if you see the condition of AIIMS, it will be horrible, because if you want to increase the number of AIIMS, you have to maintain the standard comparable to the AIIMS New Delhi. New Delhi, we know that it is our pride, but we have to think, if I use the name AIIMS, we have to maintain minimum standard. It is struggling, the Kalyani AIIMS is struggling with several issues like incomplete infrastructure, equipment shortage, and construction delay. And the absence of over 100 qualified doctors is critically affecting both the medical education and the patient care. Honorable Madam, I would like to draw your current attention that more than 2/3 of the Indian population resides in village. So it's critical to prioritize the strengthening of primary healthcare system. Here, we should establish a few model primary health centers for that additional specialized service, such as to care, the optometric care, diabetic care, basic cardiological screening, geriatric care, and psychological counseling. I urge you to take this matter seriously. And training for ASHA, Anganwadi worker, and community health officer is crucial, because the disease screening is vital in any program. The success of telemedicine largely depends upon the CHO, and the ASHA Anganwadi worker are overburdened and they are poorly paid. Government should increase their remuneration. I have to say so many things, but you are not permitting. The better support for common people and middle class family, it would be beneficial to include more essential drug under the DPCO than only reducing the cost of anti-cancer drug, 3 drugs that is not used very frequently, rarely used, and it is so costly that after even exemption, it will not will be reachable to the poor people. So protecting doctor from violence is urgent priority. You should consider this. Installment of CCTV and recruiting additional security personnel is the hour to need of the hour. All of you know that it has been notable increase the digital service and online consultation, especially lowering the COVID outbreak. But the National Digital Health Mission did not receive any additional fund in this budget, and the Telemanas is also neglecting by the government. And where the mental disorder is 10.6%, and there is treatment gap about 70 to 90%. So the government should think that the Telemanas should be in priority, and more psychiatrists should be trained and psychologists should be trained under this project, that is mental health care project. Okay, so many things. The National Immunization Program, National AIDS Control Program, all are suffering, and you should think in that way. मैं आपसी माध्यम से माननीय मंत्री जो है, our health minister and finance minister, उनको बोलना चाहती हूँ कि जो गरीब है, जो गांव में रहते हैं, जिसके मतलब जो ट्रीटमेंट ठीक ठाक से नहीं पा रहे, उसके लिए थोड़ा कृपया कीजिए, थोड़ा फंड बढ़ाइए, एंड सिर्फ ये जो आपका जो स्कीम है, डिमांड है, ये सिर्फ एम्स जैसा न्यू दिल्ली और एम्स और निम्हांस के लिए नहीं है. आप थोड़ा गरीब को लिए भी सोचिए. थैंक यू मैम.